Hi everyone, it's Dr. Christina here, the Dr. Biohacking Supermom. Today we're going to be talking about why Alzheimer's is more than genetics. When we think of the diagnosis of Alzheimer's, we think about a genetic predisposition and that if it's in your family, you have a high likelihood of having it. What we know now is that there are 6 classifications of Alzheimer's. It's not just one homogeneous root cause. And understanding what the root cause is, which type of Alzheimer's it is, can give us some clues into how to treat it. This is important when we look at ways to make a care plan to help put the symptoms into remission or even reverse some of those symptoms. Why is it important to know the different types of Alzheimer's classifications? As a functional medicine practitioner, we're always looking for the root cause of dysfunction and disease. Knowing which type of Alzheimer's you have can readily point us to treatment plans that are personalized to your specific type of dysfunction, which can lead to remission or resolution of symptoms. Type 1 Alzheimer's is called inflammatory or hot Alzheimer's. This type of Alzheimer's is driven by inflammation. The major cell for inflammation in the body is called NF-kappa B. An increased production in NF-kappa B increases amyloid production and deposition in the brain. This has a direct link to Alzheimer's because we see amyloid plaques in the brains of Alzheimer's patients. Being able to decrease this inflammation helps us stop the production of these amyloid plaques. The second type of Alzheimer's, or type 2, is called cold or atrophic Alzheimer's. This type of Alzheimer's is driven by inadequate amount of nutrients, hormones, and trophic factors. Trophic factors are the helper molecules that help develop neurons and help maintain the connections between its neighbors. The body needs all of these things in order to maintain the 5 trillion connections between its cells. Things like vitamins and minerals, adequate amounts of estrogen, testosterone, and progesterone, and other trophic factors are supremely important in the growth, development, and maintenance of the brain cells. When you have not enough of these nutrients, hormones, or trophic factors, we see this as causing decreased function in the brain and in certain parts of the brain. This leads to this type of Alzheimer's disease. Type 1.5 is called glycolytic or sweet Alzheimer's. This is Alzheimer's disease that's driven by glucose, either insulin sensitivity issues or high fasting glucose. So it has factors of type 1 and type 2 Alzheimer's. This is why it's called 1.5. It's like type 1 Alzheimer's because the sugar that's not able to be put into the cells because of the insulin resistance creates inflammation. It binds to certain proteins in the brain, and this creates inflammation, making it look very much like type 1 Alzheimer's. On the other hand, that glucose that our brain cells need to function, to feed and nourish them, doesn't get into the cells. And in that way, it's very much like the trophic type 2 Alzheimer's, because we're not getting the nutrients to actually feed the cells. Type 3 Alzheimer's is called toxic or vile Alzheimer's. This type of Alzheimer's is driven by exposure to environmental toxins like mercury, toluene, and even things like mycotoxins. Mycotoxins are toxins that come from mold. And specifically, there are a couple of mycotoxins that actually have been linked directly to Alzheimer's disease. Even though we're all at risk for environmental toxins, those with a genetic predisposition have higher risks, mostly because they usually also have impaired detoxification pathways. Type 4 Alzheimer's is called vascular or sometimes called pale. This type of Alzheimer's is driven by cardiovascular disease. When we have cardiovascular disease, simply put, we get less oxygen to certain parts of the brain. This can cause issues and dysfunction. One of the earliest signs of Alzheimer's disease is leakiness in the vasculature or the blood vessels in the brain. If you have a genetic predisposition to having Alzheimer's disease and you have cardiovascular disease, you are more at risk to this type of Alzheimer's disease. Type 5 Alzheimer's disease is called traumatic or dazed. This type of Alzheimer's comes from traumatic brain injury or head trauma. Either it could be from small, minor head injuries, mild concussions, but many repetitive ones, or it could come from a significant head trauma. When you have either of these traumatic things happen early in life, you increase your chances of Alzheimer's significantly. This trauma causes the brain to again create these amyloid plaques and deposit them into the areas where the brain has atrophied or there has been inflammation. This amyloid tissue is what we see frequently in Alzheimer's patients. This is why I often caution parents to make sure that their children who are playing contact sports are taken care of immediately and are being careful. Many little microtraumas can really increase your risk of Alzheimer's, especially if you have a genetic predisposition. Thanks for watching. Leave your questions and comments below. And for more videos like this, join my Myth-Busting Motherhood Facebook group.